There were times when I would just wish that I got appendicitis, or I would try to play out like, how can I just take a few days to recover? If you have any listeners that are looking at this and wondering if they should reach out for help, my plea to them would be yes, please do. This is important.
Hello, everyone. Welcome back to the channel. I am delighted to have such a meaningful conversation ready to go for you today with our sleep expert here, Dr. Audrey Wells. Dr. Wells is board certified in sleep medicine, obesity medicine, and she is also a mindset coach. So we will ask her to tell us more about who can certainly benefit from coming to her Super Sleep MD and also to her mindset coaching. And I wanted to highlight the importance of this conversation from part of my story being that I felt sleep deprivation was a huge component in my mental health decline. But before I express my enthusiasm so much, I'll actually explain why. So, Dr. Wells, may you please share with the audience more about yourself?
Yeah, I'm right there with you. I am excited about sleep, and I want more people to get excited about their sleep. I think it's one of the more underdeveloped skills available to everyone, and so I'm thrilled to talk about this and highlight that message today, Jillian. Thanks. Yeah, I'm a sleep medicine doc. I had been in practice for nearly 15 years. Loved it. Worked in private practice most of that time, but also in an academic setting. And recently, and with the addition of the life coach training, I took my career in a new direction. So now I'm offering help for people with struggles using CPAP to treat their sleep apnea. And I also do one on one coaching for high achievers who want to uplevel their sleep to improve their productivity and life balance. So happy to talk about all of it today.
Yes, because you also have a blog on your Super Sleep MD website, which I was exploring with a lot of different topics. Because in that Super Sleep MD, that's what she was talking about, kind of catered towards the people to help them improve their sleep with CPAP, but also relevant to anyone who sleeps, which means anyone. And the
Yeah.
topics that I was exploring today are like over the counter medications and how people think that those are always safe when they are indeed not. And I
Hmm.
think we minimize often the component of the mindset and the things that are behaviorally impacting our ability to sleep. And so before we get too far into that, I was curious, can you share how you got so interested in sleep?
For me personally, I've always sort of naturally valued sleep because I don't tolerate a whole lot of change to my sleep schedule. So I need a certain amount of sleep, otherwise, my mental function goes downhill. And for me, keeping a really regular sleep routine is also critical to function the way that I want to. On that background, when I went through my medical training, it became very clear to me that that biological need would be limiting my career choice. In other words, there were two rotations that I enjoyed very much, but they were not options from a practical standpoint because I'm, you know, it's just my nature to need sleep. So I really enjoyed my surgical rotations and I really enjoyed the ICU. Those 2 were just, very intellectually stimulating, and I liked the care for patients, but, realistically, I knew that I would not be able to adhere to the lifestyle that those 2 specialties demand. And so I ended up going into pediatrics and, at in my post-medical school training, I actually did some bench research and was being groomed to kind of take the research route. But, in my pediatric pulmonary fellowship, I actually got turned on to sleep medicine and record scratch, I went into sleep medicine, and ended up forming the majority of my practice with adults. So Adult sleep medicine, what made up the bulk of my practice. I did see kids as well. Ped specialists are even more uncommon than adult sleep specialists, but it's a field of medicine that I really enjoy, and the bread and butter of sleep medicine is insomnia and sleep apnea, and many, many times those conditions overlap within the same individual. Taking care of people and improving their sleep is super near and dear to my heart, and it's incredibly rewarding because fixing your sleep is low-hanging fruit, and you can see people improve dramatically and in a short period of time. So it's something I really enjoy.
I was so impressed by your insight and your self awareness to really cater towards what you acknowledged that you needed was sleep. And when I reflected back on surgery, I shared that same sentiment. And when I reflect back on why I finally figured out surgery wasn't for me, it never actually boiled down to the procedures. It was all I
Mm,
didn't like how I felt, and I developed like a trauma response to that prolonged sleeplessness. So I try to go back into surgery, and it has, the things that has to do with procedure might be self doubt or things that are clearly fixable. My decision to leave was I never saw that forced sleep deprivation or that deprivation ever going away. I was like, how can I ever
mhm,
prioritize that? And part of me actually still going into surgery was because I thought if I am just superhuman, then I will show my value in some way. And it shows up in conversations with other females in particular that might have done surgery is like to prove something rather
mhm.
than just honor what we need in order to function at a high level.
I really relate to that. And I want to share some experiences that I encountered in residency to kind of go in the direction that I went in recognizing sleep problems would hold me back from like a surgical specialty. When I was a resident, I would go to lengths on call to keep myself awake. I remember pinching the side of my leg or pinching under my arm if I was sitting at a table. I remember running up and down the stairs in the hospital to try to keep myself awake. Caffeine was a big part of my life. I don't even think I liked coffee before
Yeah.
residency, but then I kind of used that as a psychostimulant to promote alertness. And ironically, when I would come off of a shift or a call, and I was all pumped up on caffeine, it was really hard to relax. So it was like not only affecting my overnight, but then my time off as well. And, you know, there's something that I want to share. I'm not proud of it, but I think it's probably pretty common, which is I I did not have the attitude that I wished I would have had as I was caring for people in my training and struggling with the sleep deprivation. I felt that, if I was on call and the ER paged me, maybe I'm dating myself there, but if I was having an admission from the ER, I felt like, "Ugh, why are these people coming and I don't want to?" And there was a lot of mental resistance to that, like, they were competing with my biological need,
Yes.
and I didn't like the way I was showing up with that. There were times when I would just wish that I got appendicitis, or I would try to play out like, how can I just take a few days to recover? The truth of the matter is, even when I felt super low and the world was looking dark, I never did anything to advocate for myself. I flogged my way through and I made it to the other side. But in hindsight, I wished I would have stood up for myself and asked for help when it got pretty bad. And, in residency and even in my pulmonary fellowship to some degree, my time off in between shifts was spent just recovering. I think my social life suffered, my relationships suffered, my mental well-being suffered for sure. And it was a dark time for me. It's just something that I wish I would have done differently, and if you have any listeners that are looking at this and wondering if they should reach out for help, my plea to them would be, yes, please do. This is important.
And I can feel the pain and experience and shared experience and why this message is so important because people often do wait until they're either at a rock bottom or they don't ask for it. And as I mentioned and relate to you, when I was having, and even now when I struggle most with my dark thoughts, it's during sleep deprivation. 100% correlation always. And now I acknowledge it because I've been able to name it. Like when I'm sleep deprived, I will have darker thoughts and I just need more sleep and things will get better. But when I was in surgical residency, I had the added, I was in the military and I had the added fear of shame for leaving a residency. So I thought I was trapped. And then I was really tired and I had about a less than a mile walk to the hospital. So all those deep dark thoughts and what you could do in order to get some sleep. So some things that people may not know about my journey is that when I kind of hit my deciding factor and something that keeps me up at night now because of the hypervigilance that my body holds with it was when I was just so desperate for sleep after days about being on call. And my ex boyfriend knew I was struggling with depression. He called to check in on me. And I looked at the phone and I was so in love with him still. And I never didn't take a call from him. I'll just say that. And I said, I'm just so
Mhm.
dang tired. And I said, you know what? If I answer this phone, I had just taken a melatonin, which is something I would really love to talk to you about because it makes me really depressed. So I want to bring awareness to all, like as you had mentioned, all of the over the counter medications are not benign medications. But I did not answer the phone call. And my ex boyfriend ended up passing away a couple days later. And I was so livid at myself because, I mean, there was nothing I could have done how he passed away. However, I was just, it flashed before my eyes all of the years I spent chasing someone else's dreams, which are exactly what this channel is all about. It's trying to bring awareness. So, are we really in alignment with what we truly want? Are we really prioritizing our human basic needs in a way that's going to improve our quality of life and help us to really connect with people? Because when we hear about the term burnout or whatever moral injury or whatever the things are that make us show up in a way we don't want to, that inability to be fully human and process and sleep and go pee when we want to and eat when we want to is really a core aspect of all of the discussions. And even after I was certain that it was a life or death decision to leave surgery, I didn't. And I was trying to save my military career. So I was trying to optimize my wellness in order to go to an appeal with the best mindset I possibly could. And it
Mhm.
was that appeal that drove, I actually went inpatient to an eating disorder locked unit and I finally could sleep and eat.
Mhm.
It took being locked into a unit at 28 years old. And I have the opportunity to know what that feels like to be in a locked unit in a psych
Mhm.
ward and for that to be what it takes to feel like you can finally calm down. I got the best sleep there because they take away your phone, they take away everything. However, I will say I was in that unit looking for jobs because I wasn't sure if I was going to be discharged from the military or not. So just in case, I spent a lot of
Mhm.
inpatient admission not processing things, not giving myself permission to lean into what I needed at that time. And maybe at that time what I needed was to whatever I gave myself was just the opportunity to allow someone else to take control of my life for a while. Um, and and so I also wanted to offer that because I know you're not alone, and I think that your passion and that lived experience of saying, "Hey, I didn't show up the way I want to, and I want to help others," and you're creating so much meaning out of that pain, and I really appreciate you for being so vulnerable and honest about it, and all of the work that you're doing to really bring awareness to this issue.
This is my passion project. I really think it's important. And I mentioned treating sleep apnea and insomnia under the umbrella of my clinic.
Mhm.
But sleep loss and habitual voluntary sleep deprivation is by far the most common sleep problem we have. It's just that as a sleep medicine doctor, people usually don't show up with that as their complaint. So it's my hope that by stepping out of the clinic, I can be effective in letting people know. I want to say something about your experience not taking the call um, from your ex boyfriend. Of course, you could have never known what happened. But I also want to say the brain or the mind that you're operating with under sleep deprivation is different than the brain or the mind that you're operating with when you're well rested and at your highest and best self. You're defending your need for sleep, which is a fundamental biological need. It makes your vision very narrow and focused on getting what you need. And if you were to look at Maslow's hierarchy of needs, it's the triangle. And at the bottom, there's air, breathing, there's sleep, food, shelter, clothing, warmth, all kind of under one thing, and reproduction. This is what humans need as a foundation to their survival. I want to say that compared to food, let's say, you can go weeks without food. You can go a number of days without water. And, if you were truly not eating or drinking, you could last about 3 days or so. But compared to sleep loss, going without sleep, you start to look and feel psychotic
Yeah.
if you have 24, 36, 48 hours of sleep loss. You're not functioning well. You're functioning at a very basic level for self preservation. And I think there's an element of that um, when we look at our interactions with other people. It kind of resonates with me because this idea of defending myself against people who want to get admitted to my floor in the hospital, you know, it's a very primitive response, involuntary almost. And when you evaluate that response later, after you've recovered,
Mhm.
I think there's a tendency to be quite hard on yourself. There's some judgment there, there's some regret. But the truth was, you weren't getting what you needed, and you needed to defend yourself. So I think when people get backed into a corner that way, it's really hard. And when it's a chronic problem, it weighs on you, it's burdensome. Starting to shift that around and repair is a challenge, but it is available to everybody all the time. That's something I'm trying to promote.
Yeah, and I really want to talk about because I was just thinking about when I left surgery, I still haven't slept, right? So much of what we can talk about with the second aspect of your work with the coaching of if we can shift our concept of productivity into how many sleep hours we have, which is truly, I was when I really analyzed how can I shift and how can I play the game with my brain? Because I need to be able to really make it a priority. Like, I know it's a priority. We know it's a priority. You really can hallucinate when you sleep deprived. And
Yeah.
for me, my deciding moment, and even looking back at journals I wrote when sleep deprived, very glad I have those because I was like, I was out of my mind. And my defining moment was not being able to remember my own name on my consent and walking out of the room. I said, and because patient safety are high priority to me, it wasn't my safety. It was like, I can't keep this patient safe. I don't know my name. And I
Mhm.
walked out and my chief thankfully was able to step in for me, but it took someone else's safety being in my head compromise in order for me to then prioritize my sleep. So then I have shifted my career completely in order to create a life. And I've turned down finances from call. I said, no, it's a hard stop for me. I will not accept call. I know I do not ever want to put myself in that predicament. So, what my ex boyfriend that moment taught me was like, here were my values. My values were conflicting. The things that were I was prioritizing, however, were not my values, staying up late. And I didn't love surgery enough in order to compromise the things that I truly value, which is genuine human connections. There are surgeons out there that value that, but like my whole life, I really, this YouTube channel, like that's the core priority. So I'm willing to sacrifice any high earning income in order to get sleep because I know that that enriches the quality of your life so much that it's like
Mhm.
it's not even a question. I mean, I'm like, nah, I'm sorry. And so then, now that I have the time, I haven't yet modified, I haven't yet unlearned to relearn the mindset of productivity. And so I'll stay up late at night doing things in order to be busy, productive, or maybe not sit alone with my own thoughts. So, with that in mind, I was curious what comes up when you're coaching people? Like, what would be a very common topic?
This is a common topic, and it's an illusion. The
Yes.
il the illusion is by shortening your sleep, crimping it down so you can get more done in your day, you're gonna increase your productivity. It's just not the case. If you are cutting your sleep short, your ability to learn gets depressed. Your creativity is lower. In fact, it sort of ages your brain prematurely over time if you continue habitually to voluntarily restrict your sleep. So it's a myth. And when you describe situations like when you wrote things in your papers while you were sleep deprived, what I'd like to suggest is as you were writing those things, you were not aware that you weren't functioning as your highest and best self. It was only later when you reread, probably from a more sleep replenished brain, that you were able to recognize that. And so it's a little bit tricky in that way because I think the tendency is to minimize the effect of sleep loss in favor of, well, there's more hours in my day. So it's a hard concept to drive home until people have experience with the idea that a slept brain is more efficient in all aspects compared to one that is sleep deprived.
Just want to sit on that for that moment. And I also have the image of like taking out the trash, like why our brains have evolved so that we need sleep and the processes that need to happen during that time. Can you share more about what happens when we're sleeping?
Yeah, sleep is really important from a physical standpoint as well as a mental standpoint. So, in the physical part, that includes the brain, the physical brain, and the rest of the body. It's important for metabolism, for weight management, for uh, management of the immune system and immunity, and for cellular repair, of course. All of these things are physiological processes that take place during sleep. But the other part is the mind component, and I'm talking about the mind as sort of what the brain produces. Um, the mind benefits from sleep in very important ways. So I mentioned creativity and learning. Those are processes that come out of slow wave deep sleep, which is more prevalent in the first half of the night. And then in the second half of the night, when most human beings are having the majority of their REM sleep or dream sleep, you're having this wonderful virtual reality experience where the brain is tossing all of the things that it's exposed to and trying to work it in new ways and also emotionally recover and regulate so that you can sort of wake up renewed and refreshed and take on all the stimulation of the following day. So there's nothing about sleep that's wasted, and compressing your sleep on either end is either going to compress more REM in the morning hours or more slow wave deep sleep in the late evening hours. Um, I think that the emotional regulation is something that people sort of power through, and it's it's too bad because, when you're undergoing so many things that demand your attention, so much stimulation, so many inputs, you really need the power of your frontal lobes to inhibit all of that emotional agitation that your amygdala and limbic system can throw out. But the frontal lobes suffer most when you cut your sleep short.
Wow. It's really putting me back into what was happening when I was a surgical resident. I just remember always wanting to cry because you're so tired. Just like that tremendous psych ache. You're just like, I'm so tired.
Yeah. And it's like multi-level, right? They're just worn out on all fronts.
Yeah, I said I had pan burnout, and I
Mhm.
dealt with it. My physiological coping skill was it made me feel better not to eat because I was too tired to do anything, and then that added to not being able to sleep because we know stress impacts your sleep, and I had those 2 to 4 a.m. morning awakenings from that increased anxiety. And so when we were thinking about sleep, one thing I was thinking too that I wish if people are in residency or in a situation, things that they could change today. Because one thing I was noting is, we always try to get everything jam packed, so people might wake up super early to exercise, which is something I did. I compromised my sleep in order to run, and had I done it again, I would have found ways to have movement during the day and prioritize sleep. So if
Mhm.
someone's really in like a time compressed situation, what would be some good things to really counsel them on?
If it's simply not possible to target 7 or 8 hours of sleep, I would, have a couple of pieces of advice. So, one is try to make the minimum 6. Things really start going downhill when you're getting less than 6 hours of sleep. It's sort of a dose response curve, if you will. The other thing that's important is to try to keep your sleep as regular as possible. And by that, I mean a pattern where you're going to bed at the same time and getting up at the same time. I tell people an hour is kind of the wiggle room allowed at each end of your sleep cycle. So within an hour, bedtime, and within an hour, wake up time. But the more regular and consistent you can make that, the more your brain is prepared to fall asleep when you want to and wake up when you want to because it can anticipate that time a little bit. The third thing that I think might be helpful is to really look at managing light to improve your sleep and wakefulness. So, most folks think of the light exposure at night as detrimental to sleep. I think that's made it into the common vernacular, but um, the blue light blocker setting on your phone or the computer is pretty minimal, to be honest. You want to add to that some blue light blocker glasses, and if you can get ones with orange tint, that's going to be most effective. But then on the flip side of things, when you're waking up in the morning, you can take advantage of the power of light to sharpen up that transition between your sleep and wake. You can use a, artificial light source to get that light exposure and promote wakefulness for your day, and that can last for several hours. And whenever you're thinking about improving sleep quality, it really starts way earlier in the day, even when you wake up, because that bright light exposure in the morning is going to give your brain the contrast it needs to feel sleepy as night approaches. So we are truly 24-hour beings, and your sleep and wakefulness it's a wonderful dance, but attention to your sleep begins even as you're waking up in the morning. So that bright light can be helpful. I have an example here if you want me to show you.
Yes, I do.
Yeah. So this is an artificial light source. You can see it just kind of looks like a tablet and it has a little stand like this. I am here in Minnesota, so this comes in handy in the short days of winter. But this one has a maximum brightness of 10,000 lux, and you can make it brighter or not so bright. It's not really necessary to kind of hold it like this. That not practical
I
either.
know they tell you that though, because I had seasonal affective disorder. I lived in Michigan 2 years ago, and I'm from Illinois.
Yes.
And so I had a bright light. It did, and I have daylight light bulbs in it was game changer for me in
Oh,
Michigan.
good. Yeah.
Yes. Yeah.
So I sit with this sort of a couple of feet maximum, so 18 inches to 24 inches from your retina. There's actually cells in the back of your retina that contain a pigment called melanopsin that signal to your brain's body clock when you get exposed to this bright light that it's time to be awake. And that resets your brain's body clock. So the light can be really helpful for people who do need to compress their sleep time.
This conversation is a commitment to us both because I'm starting, as I was mentioning to you, I'm making it, it is becoming my new productivity measurement. Say, how much sleep did I get? Because I will share with you, because I'll very much highlight how inappropriately I prepare for sleep throughout the whole day. I don't get enough sleep, so I pump up on caffeine, and then I'll even say, okay, I'm going to cut off caffeine at 12, and then 12 becomes 2, and then 2 becomes 6 again. And it's not even a second before that happens, because it's behavioral, right? It's that, like, I need to make a commitment. And then Dr. Tamara Beckford was here. We talked about self-care, and she's got an hour before she goes to sleep, she doesn't look at social media or
Mhm.
electronics, and an hour after she wakes up. And I'm like, that sounds amazing. I lasted 3 days, and I was like, oh my gosh. I feel it's that compulsory. It's like, just because it becomes part of your behavior or your buffering. And as we think about the light exposure from our electronics, I would love to hear also the other components that factor in when we're engaged with social media.
Yeah, it's very stimulating. It's stimulating not only as a light source, but also emotionally. And people who engage in social media get little dopamine hits. I'm one of them, of course. I'm a human being and I'm not a huge fan of social media, but I joined Facebook, I think, in 2018. And, it's useful in a lot of ways. But I do notice when I'm bored, I reach for my phone. And I think that's a really common pattern. Being bored is uncomfortable. And so if your phone is like an extension of your hand, you have something that alleviates that discomfort straight away. The problem is your brain needs space. It needs space to play and to just kind of do some free range thinking. And in that sense, people who are frequently using or engaged with social media don't have any space in their day until they put their head on the pillow at night, and then their brain comes out to
Yeah.
play, and that's where the monkey mind comes from. So, I think that looking at your social media habit with, a very frank attitude is one way to go. Just noticing when you're bored and trying to stay in that feeling for a little bit. It's something that you can practice. I do a meditation in the morning, which really helps me. I wouldn't call it a necessarily clean meditation. I think it's just some quiet time to let my brain roam around and do whatever brain does. And it proves to me every day that I can do that and not die. So
Yeah.
it's just a touchstone, and I have an easier time doing that in the morning. compared to, in the evening when things are a little more chaotic and I'm dealing with all the residue of the day before.
Yeah, and I think I heard you say it's more important if we had to prioritize getting on a schedule that morning wake up time. Is that right? Or what's the science behind that, if you will?
Yeah, that's a great question. So while it is important for maximum sleep quality to keep bedtime and wake up time consistent, it turns out that the wake up time is slightly better at maintaining consistency and resetting our clocks. So if you had to pick one, the wake up time is going to be more valuable for you.
Great. I love how we can kind of stagger the improvements, right?
Yeah.
Next best step, since people are here on our YouTube journey with us, they can see, I'm going to practice what I preach and see the evolution and be able to share. Because when I took your, is it, do they say sated or the sleep test that you have available, I scored really, really poorly, everyone. So I'm going to give the links to her website so you can let me know how well you did in comparison. No competition. If you are competing with me, we want you to score better than I did on your prioritization of your sleep. And with that being said, so we shared that you really help people to sleep better who use CPAP, and you also are a coach for individuals who need more support with their mindset. And I anticipate you do that as well for the people that have CPAP to kind of be all
Yeah.
inclusive. For both of those modalities, can you share where people can find you?
Yeah. So for CPAP users, they can find me at supersleepmd.com. Very soon, I'm going to be releasing a virtual course that people can take at their own pace. And then I'll also do group coaching on a weekly basis if they want to sign up for that component of the program too. And that's where I have my blog. So I write about sleep apnea, but I also love writing about uh, concepts and misconceptions related to sleep. It's all very interesting, and I hope that I can attract people who are looking to improve. My one-on-one coaching program is at bossmythoughts.com. And that's for folks who are high achievers and feel like their life and their productivity is competing with their sleep, but they're not sure what to do next. And I can certainly help with that.
I love it. And is there any last words that you think I haven't asked you yet or that you would like to leave with the audience as the key takeaways?
And this is kind of in the vein of sleep as a biological need. There is the concept of morningness and eveningness, or lark and owl, to sort of associate it with an animal. And if you are an extreme lark or an extreme owl, that may affect some of your life choices. I would invite you to go to my website and take the questionnaire to find out where you fall on that spectrum. It's just another piece of information under your belt to sort of honor where you're at genetically and biologically so that you can make healthy choices for yourself.
I'm so grateful for you. Thank you, everyone, for watching. Make sure to reach out to Dr. Wells and make sure to remember you are humans, not robots. Prioritize sleep. Comment below how you're doing and let us know as you start to prioritize it or if you are prioritizing it, how we can be on this journey together to really change the narrative in our culture that is prioritizing things other than sleep and human basic needs. So thank you so much, Dr. Wells, for being here. And thank you, everyone, for watching.